So when a dental crown comes off, it's generally for one of two different reasons. The first reason is the most ideal situation. Basically, when we put crowns on teeth, we've got the tooth and we've got the crown, and we use a dental cement to bond that crown into place. And over time, sometimes that dental cement can kind of erode and wear away, especially some of the older cements. And eventually the force in your mouth, whether it's from chewing something with a lot of suction or a lot of stickiness, can overwhelm that cement strength. So if you have a crown come off and you come into your dental office and they take a look at it and the tooth underneath is still healthy and the crown is still intact, a lot of times it's just as simple as cleaning the crown out, re-cementing it back in place. No problem, go back on with your day and everything is like it was before. So the second reason that a crown will come off is because it no longer fits intimately with the shape of the tooth when it was originally made. And then usually the reason for that is either breakdown of the tooth or decay that's crept underneath the tooth and caused that tooth to no longer be the same shape it was when that crown was originally made. In this situation, a lot of times the patient will come in the office and part of the actual tooth is in the inside of the crown. And when that happens, even though we may be able to clean out the crown and make it fit back over the remaining tooth, that's not an ideal situation because the tooth is no longer intimately protected by the crown and it's going to debond and cause problems down the road. So unfortunately, in that situation, the appropriate treatment is to remove any unhealthy tooth structure, modify the existing tooth, and make a new crown to protect the tooth going forward. Those are the two main dental reasons that crowns fail. Now, there's a third kind of subcategory, which is when the teeth are treated in a way they're not designed for. So if you assume that there's enough healthy tooth there for the crown to bond on, generally speaking, a crown's not just going to debond unless it's something unfortunate that the patient is doing at home, putting forces on the crown that it wasn't designed to handle. Whether that's clenching, whether it's chewing on ice, whether it's eating really sticky, hard things that actually grab onto the surface of the tooth structure. Unfortunately, dental habits like biting things with your nails, trying to open things with your mouth, while it's a lot more convenient, a lot of times that overwhelms the capacity of those crowns, and it can either lead to crown breaking or it can lead to the crown debonding and coming off. So tell me below in the comments, I would love to hear a story about how you lost a crown and what the end result was. And if you're in a situation where you're worried about getting crowns, or if you're worried about the crowns you have coming off, give us a call, reach out to us. I'd love to have you come in and I can take a look and reassure you that everything's going to be okay. I'm Dr. Brett Langston, prosthodontist and owner of Dental Implant and Aesthetic Specialist here in Brookhaven, Georgia. I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.